I've done some reviews and I talked to the neonatologist, and it turns out that in the best of care in the world, about 1 in every 10 babies in a newborn unit gets an infection. Not all of them die, but the infection is incredibly common. It's 10%. It's very, very high.
Pediatrician Dr. David Bratt is hopeful that one of the suggestions of the Pan American Health Organization team, which reviewed the incident at the Port of Spain General Hospital's NICU, would be the implementation of upgraded neonatal units at public health institutions and more neonatologists and nurses specialized in neonatal care, as he said there is a need for this.
The nurses are so important in any intensive care unit. They are really the one. We can't continue with this 1 to 3. One nurse taking care of 3 premature babies, 1 to 4 in some. That is not what is called a level 3, which is what we're looking for. So that is what I hope is going to come out of this.
Between April 4th and 9th, 7 babies died from a bacterial infection. Since then, more parents who have lost their babies outside of this time frame have come forward claiming that their babies died due to negligence. But Dr. Bratt explained that it will be difficult to determine those claims.
That's going to be difficult to do and going to be difficult to prove. Babies, unfortunately, as I said, in the best of hands, premature babies are going to die.
Even with the deaths of the 7 babies between April 4th and 9th, he said parents should not be fearful to let their newborns receive care at the public health institutions.
People need to know this. The private sector cannot take care of premature babies. They can't. The private sector cannot take care of children, by and large. Any child who's seriously ill needs to go to Mount Hope or to San Fernando Hospital or Sangre Grande. I'm not clear about the other hospitals. I'm not sure what is going on there. And people need to understand this. The private sector can't take care of seriously ill children. It's the public sector which is doing a reasonably good job, in my view.
While many are concerned about the emotional state of the parents, a thought should also be spared for the medical team.
I feel sorry for the pediatrician, for the neonatologist too, because it's heartbreaking. And I was speaking to one of them last week, and she was just torn up about what is happening. But then the nurses are grieving. These are nurses that work hard in situations that are not the best, and they do their best most of the time. And yet now they seem to be being blamed for what is happening, and I don't think that is the right.
At the end of the PAHO review, a final report will be submitted to the Ministry of Health. Mahalia Joseph Wharton, TTT News.